American Agenda. I'm Bob Sellers, along with Heather Childers. Health officials are now warning of a new coronavirus variant, the Delta Plus variant, which some experts believe is more transmissible than the original Delta variant. It's been detected in several countries, including the UK, the United States, and India. Joining us now to discuss is author of What Your Patient Won't or Can't Tell You, Dr. EvanLevine. Levine or Levine? Correct me here, doctor.
Like the great one, Levine.
Okay, the great one, Levine. So Dr. Levine, when I see something like this, I'm always wondering whether the government is trying to put this in play to try to create an impression in the public that would lead to their next step, whatever that is. How do you read this?
I read this as just another mutant, another mutation. I mean,
more dangerous? Is it more dangerous?
Some mutations may be more dangerous. Some mutations may be less dangerous. That's what evolution is, random mutation. This possibly is more dangerous. One mutation may be less dangerous. But here's the key. No one really wants to continue to lock down. No one really wants to wear masks. And that's why I am a huge advocate of vaccination. So what we need to do is we all need to just vaccinate. That's the answer to that. Sure, there'll be mutations throughout history. Some of these mutations we don't even know about because they're less infectious. There'll be some mutations that are more infectious.
So in terms of fighting that with vaccines, do new vaccines need to be developed, or are these boosters going to be good enough that we're now hearing talk of?
Well, first, let me say, I'm not a big fan of Big Pharma. And although the researchers and the doctors out there, they want to make you feel better, there are people in back rooms that would love to have boosters out there to improve their profits. I mean, I'm not foolish. Do I necessarily need a booster? At this point, I would not accept one, but there might be the elderly who have poor response to the vaccine who may. But right now, the vaccines are very effective. If you look and compare this vaccine effectiveness to a classic flu vaccine, which may only be 50% effective, right now the vaccine is effective, it works, and now is the time to vaccinate. Let's not all start vaccinating in 2 or 3 years when the vaccine may not be effective against an Omega variant, for example.
Yeah.
Okay. All right. Let's hear that the head of National Institute of Health suggested that parents wear masks at home to protect unvaccinated children. Take a listen to this.
That's the reason why the recommendations are for kids under 12 that they avoid being in places where they might get infected, which means recommendations of mask wearing in schools, and that at home, parents of unvaccinated kids should be thoughtful about this, and the recommendation is to wear masks there as well.
I heard that big sigh, doctor.
Oh, my goodness. You see, and this is why some people don't trust others when they say vaccinate. I mean, let's talk about social development. Let's talk about reality. Let's talk about hugs and kisses in your home where mom and dad is wearing a mask. This is an unfortunate statement, and I don't agree with it at all.
What about this? Do you agree with this? The New York Times reporting that the FDA is aiming to give final approval to the Pfizer vaccine, going back to what we were speaking about earlier. That could happen by early next month. And in conjunction with that, a number of universities and hospitals are expected to mandate inoculation once a vaccine is fully approved and it's no longer just emergency use authorization. So from your comments earlier saying that now is the time for people to get vaccinated, I would assume that you would agree with that?
100%, yes. Okay. I think the FDA does need to approve it because there are people out there that doubt the efficacy and they're concerned about the adverse effects. And I think the FDA, by approving the drug, will help convince some who are unsure to vaccinate. Mandating for healthcare workers, I'm all for it. I don't want to infect an elderly person who is vaccinated but let's say they have a leukemia or a cancer and their immunity is just not there. I'm a healthcare worker. I go to work in an emergency room, and 3 days later, I get a flu-like illness, and I'm sick for maybe a week and I'm okay, but I infected people, infected that elderly woman who was vaccinated but did not have the greatest immune response, and lo and behold, a week later, she's in the ICU or worse. I cannot accept that responsibility. If you're a healthcare worker, your priority is to take care of your patients. Your patient comes first. Get vaccinated.
All right. Dr. Levine, thank you very much for joining us.
Thank you.
And coming up, the August